doing great damage when it comes to anxiety, depression, and even suicide. It spans the ages, and now everyone is suffering, but children are particularly at risk.
Of emergency department visits we're seeing for mental health conditions among youth has increased dramatically.
They can't play with friends, they're not in school, sports are canceled, and for young ones, it feels like their life as they know it is lost.
We know that children are facing increased social isolation and losses of their usual sources of support, such as their peers, their teachers, or their coaches. And many children are no longer able to access their usual sources of mental health care.
At Lurie Children's Hospital, emergency room physicians are seeing a 50% increase in mental health visits.
Every day we see at least 10 children or youth, if not more.
So while children are not getting as sick as adults with SARS-CoV-2, the virus that causes COVID-19, there is another contagion that is threatening them.
Children and youth are very much impacted by what's going on in their family. We hear a lot about how COVID-19 is impacting adults more than youth. And that's true in terms of their physical health. More adults are being hospitalized or dying from the pandemic. But really among youth, it's a mental health crisis.
Whether it's the loss of a family member or loved ones with building anxiety and depression, the weight of the pandemic is falling on children hard.
Children with underlying depression and anxiety may experience worsening of their symptoms. And we are unfortunately also seeing increases in teens with suicidal thoughts.
Doctors urge parents to look for the signs.
You might notice subtle things such as that your child is having difficulty sleeping. You might notice that they're tearful or just more stressed compared to their usual stress level. In all of those cases, a good first step, if you're noticing any warning signs, is to talk to your pediatrician.
And take action when life is in danger.
Anytime that you're worried that your child might harm themselves or another person is certainly an indication to come straight to the emergency room.
Most importantly, make the home a safe place to talk, to live, and to prevent loss of life. That means locking up firearms, medications, and liquor.
We do know that many suicides by teens are impulsive acts and often are not predictable. So keeping these unsafe items locked away safely is one of the best things you can do to prevent suicide.
If you or someone you care about are having difficulty in pandemic or otherwise, please reach out for help. We have resources on our website. Back to you.
Okay, so, obviously another pleasant topic as we continue to be stressed, but an important topic, especially if you have kids going through divorce, or if you just have a kid and you're going through COVID. These are things we need to be looking at. There are obviously resources. She's last, but certainly not least. Let me bring in Emily. Emily, you're here in 3, 2, 1. Hi, welcome to Sossi Talk. How are you?
Hi, thank you so much for having me. I'm so happy to be here, and I think this is a perfect time to talk about this continuing issue in terms of COVID and then divorce among our children and teens.
And I'm so glad that we got to have you on here. Some people don't know who you are. Shame on them, as I continuously say. But tell us who you are and what you do.
Well, thank you so much for the compliments. So I am a marriage and family therapist. I'm very fortunate. I have the privilege of working with Dr. Davenport at the Institute for Couple and Family Enhancement. And then when I'm not there, I have the privilege of working at an archdiocesan high school here in San Antonio. So I've had the really cool opportunity to see not only what mental health among our children and teens is looking like in a community, in a situation where children are seeking help and outpatient therapy services, but also what it's looking at, here on our school campuses in town.
So in general for you, when you're talking about COVID and kids, what are your general concerns? We're not talking about kids in divorce. We're just talking about kids in general.
Yeah. So I would say, and I'm so glad the video worked because that was great. I would say Exactly what they said in the video. Typically, the number one thing that walks into our office, number 1 and 2 concerns are anxiety and depression, and those have only been amplified by COVID. It started off more as a high raise in anxiety, and then as the pandemic continued, and just the social isolation, not being able to connect with the community, now we're seeing a rise in depression, and especially among teens, I'm seeing a big rise in issues surrounding like insecurity and self-esteem.
And what I noticed with some of the kids we deal with, some of the kids don't want to go back to school.
Yes, so I think that most teenagers are pretty divided. So the school that I work at in particular, they have the option to come a full 4 days a week. They can be all virtual, or they can come 2 days a week. So I would say that some kids are definitely like, virtual learning works for me. I'm okay doing at home. Others would probably prefer to stay at home, but it does not work for them. So we're definitely seeing a raise in terms of like our numbers of students failing classes. And then some really enjoy the split of being able to come, 2 days a week and being home 2 days a week.
What are in kids in general, and I want to keep talking about that because I don't want to just focus on kids in divorce, because I hope we have many people watching, but
Yes.
just kids in general. What are the red flags in your mind, things that concern you when you have kids during this time?
So several different things. Dr. Davenport talked about, a lot about a family system, but when our schools were also looking at the community system. And so, one of the biggest ways that, students are referred, especially in the school setting, are from their friends. And, friends communicating a concern about another friend. And because friends are not seeing their friends on campus, that first like line of mental health defense is not there. So whereas, historically in previous years, if a friend didn't show up to class, for half a day or multiple days, they would be reaching out to their friend, like, are you okay? What's going on? Communicating the concern to us. And now if friends don't show up for 3 days, they're like, oh, they're just doing virtual learning. So I'm seeing definitely a delay in just the community support. And then also seeing a lot of anxiety for those students that are virtual, in terms of, feeling uncomfortable showing themselves on camera, being worried and insecure about, what their classmates are thinking of them and how they look on camera. Things that most people wouldn't even think about, kids being spaced out in the lunchroom and being anxious and insecure of people watching them eat and, judging how they're eating, just like a hyper sense of anxiety. And yeah.
And Emily, you kind of brought this up, made me think about this. We talk about bullying in school. I mean, is there, and obviously there's virtual bullying, but we typically think about the kids going to school. We don't think about them being bullied on virtual learning.
Mm-hmm.
Is there anything like that going on that you can see?
Yes, I would say, there's, that's one of the sad realities of our world right now, is that bullying is very present and alive today. And, I think some of it is just, an insecurity, anxiety piece of what are people, going to say about me. And others are, at the beginning of the pandemic, especially, different trends going around about, people taking videos of their